Gabapentin is a medication that has been widely used in the medical field for various purposes. As an experienced human writer, I'm excited to provide you with a comprehensive guide on the different uses of this versatile drug. Gabapentin, originally developed as an anticonvulsant, has since found applications in the treatment of a wide range of medical conditions, from epilepsy and neuropathic pain to anxiety disorders and restless leg syndrome. Understanding the mechanism of action, gabapentin is believed to work by modulating the activity of certain neurotransmitters in the brain, specifically by binding to the alpha-2 delta subunit of voltage-gated calcium channels. This interaction helps to reduce the release of excitatory neurotransmitters, which can lead to a reduction in the frequency and severity of seizures, as well as a decrease in the perception of pain and other neurological symptoms. Gabapentin for epilepsy and seizures. One of the primary uses of gabapentin is in the treatment of epilepsy and seizures. Gabapentin has been approved by the FDA for use as an adjunctive therapy in the management of partial-onset seizures in adults and children as young as 3 years old. By working to stabilize the electrical activity in the brain, gabapentin can help to reduce the frequency and intensity of seizures, improving the overall quality of life for individuals living with epilepsy. Gabapentin for neuropathic pain. Gabapentin has also proven to be an effective treatment for neuropathic pain, which is pain that arises from damage or dysfunction in the nervous system. This type of pain can be challenging to manage, but gabapentin has been shown to be particularly helpful in reducing the symptoms of conditions such as diabetic neuropathy, postherpetic neuralgia, pain following shingles, trigeminal neuralgia, a type of facial pain, spinal cord injury-related pain. By targeting the underlying mechanisms of neuropathic pain, gabapentin can provide significant relief for individuals suffering from these debilitating conditions. Gabapentin for anxiety disorders. In addition to its use in the treatment of epilepsy and neuropathic pain, gabapentin has also been prescribed off-label for the management of certain anxiety disorders. While it is not approved by the FDA for this purpose, some healthcare providers have found that gabapentin can be helpful in reducing the symptoms of conditions such as generalized anxiety disorder, GAD, social anxiety disorder, panic disorder. The calming and anxiolytic, anxiety-reducing effects of gabapentin are thought to be due to its ability to modulate the activity of neurotransmitters involved in the regulation of mood and emotional responses. Gabapentin for restless leg syndrome. Restless leg syndrome, RLS, is a neurological condition characterized by an irresistible urge to move the legs, often accompanied by uncomfortable sensations. Gabapentin has been found to be effective in the treatment of RLS, as it can help to reduce the intensity of the symptoms and improve sleep quality for those affected. Off-label uses of gabapentin. While gabapentin is primarily approved for the treatment of epilepsy, neuropathic pain, and, in some cases, anxiety disorders, healthcare providers may also prescribe it off-label for other conditions. Some examples of off-label uses of gabapentin include chronic pain management, fibromyalgia, alcohol and opioid withdrawal, bipolar disorder, hot flashes associated with menopause. It's important to note that the use of gabapentin for these off-label purposes may not be as well studied or supported by clinical evidence as its approved indications. Potential side effects and precautions. Like any medication, gabapentin can have potential side effects, which may include drowsiness, dizziness, fatigue, blurred vision, dry mouth, swelling in the hands and feet. It's crucial to discuss these potential side effects with your healthcare provider and to report any adverse reactions promptly. Additionally, gabapentin may interact with certain other medications, so it's important to inform your healthcare provider about all the medications you are currently taking. Dosage recommendations. The appropriate dosage of gabapentin can vary depending on the specific condition being treated, the individual's age, and other factors. In general, the starting dose of gabapentin is typically low and then gradually increased over time to achieve the desired therapeutic effect. It's important to follow the dosage instructions provided by your healthcare provider and to not exceed the recommended dose without their guidance. Conclusion: gabapentin is a versatile medication with a wide range of applications in the medical field. From its use in the treatment of epilepsy and neuropathic pain to its potential benefits for anxiety disorders and restless leg syndrome, this drug has proven to be a valuable tool in the management of various neurological and pain-related conditions. By understanding the mechanism of action, potential side effects, and appropriate dosage recommendations, healthcare providers can work with their patients to determine the most effective and safe use of gabapentin for their individual needs. If you or someone you know is experiencing any of the conditions mentioned in this video and would like to explore the potential benefits of gabapentin, I encourage you to speak with your healthcare provider. They can help you determine if this medication may be a suitable option for your specific needs and provide guidance on the appropriate dosage and monitoring. Don't hesitate to advocate for your health and seek the care you deserve.